Okay, today we are going to speak about a topic that is a real health issue for many people. It is the fungus Candida, otherwise known as systemic candidiasis, because it is a systemic problem. It spreads throughout the whole body. And the two major pioneers who wrote the first books on Candida, the yeast connection, Dr. Crook, and the missing diagnosis, Dr. Truss. This is probably maybe 35 years ago now. Because they were seeing a lot of symptoms in patients that couldn't fit into a specific diagnosis, and then they started putting things together and realizing that this was a yeast infection that was spreading throughout the body. Now, up until that point, medical doctors knew about Candida, and they do know about Candida, but they think that Candida is only present in people that are immune compromised, such as AIDS patients. And of course, AIDS patients can actually die of Candida. Many of them do die of Candida. They don't die of AIDS. They die of Candida because Candida is a proliferative organism that will spread through the body very quickly, producing phospholipase enzymes and digesting tissue. It's a putrefactive organism. It feeds on dead material, basically, like molds and fungi. So it digests tissues and cells, and it takes us back to the soil. This is what its job is. So of course, if you don't have an immune system to fight it off, then it will spread very quickly and it can kill you. And many people do actually die of Candida albicans. Every year there are thousands of people that die, those that are immune compromised. If your immune system is working well, then there will be a constant fight, but of course there will be many symptoms of Candida, as we will look at. So this is truly a new epidemic or a new pandemic, because it is spreading around the world in very many different cultures. And one of the doctors have said few illnesses have sparked as much hostility between the medical community and the lay public as the chronic candidiasis syndrome. So what is it? Basically, it's a fungus. It is normally present in the gastrointestinal tract of newborn babies. They have found it in excess of 90% of newborn babies. It's a unicellular organism, so it's just literally one cell organism. It buds asexually and produces daughter cells. And in this normal form, non-pathogenic, non-mycelial, it's okay. It sits there and it's covered by the blanket of friendly bacteria, all this acidophilus and bifidobacteria, and it sleeps. It's dormant. Okay, we've already mentioned that it is present in pretty much all people from birth, and it helps to digest us when we die. That's the function. So when we die and our friendly bacteria die, there is a trigger, because the Candida has one gene controlling two proteins. It's a pleomorphic organism in that sense, because when it is in its normal form, the gene is switched off. When the friendly bacteria die off, then that gene switches on and begins to form a pathogenic form of Candida. So it's the same Candida, it's just changing forms because of a trigger, and the trigger now is the changing milieu in the gastrointestinal tract. So what can change the milieu in the gastrointestinal tract? Antibiotics can kill off a lot of the friendly bacteria. Other drugs, eating a lot of acidic foods. Sugar is extremely acidic. Refined foods is very acidic. So eating the wrong foods, drinking heavily, taking other narcotics, street drugs, and what have you. All of these factors can knock out the friendly bacteria to the point where they reduce to a certain level, and there's, you know, that's the trigger for the gene switch to switch on and begin this pleomorphic change. Okay, that's what we've just said. So as the friendly bacteria die off, then there is what's known as a dysbiosis, where the bad bacteria increase against the good bacteria, and this sets the stage for the normal budding Candida to change forms into this mycelial form, which has these pseudohyphae and these blastoconidia, which secrete phospholipase enzymes at the end of these, and these phospholipase enzymes are what digest tissues. And they penetrate, and they can penetrate anywhere in the body, anywhere. They have no preference. They can go into the kidneys, they can live in the stomach, particularly if the patient is suffering from hypochlorhydria, not enough hydrochloric acid production. They can go into the skin and cause a whole load of skin problems. Usually eczema, psoriasis, acne. You will find a lot of Candida living in there. Wherever there's moisture, mucous membranes, they will grow and they will penetrate. So this is the mycelial form of Candida. This is the pathogenic mycelial form. This is the one that will cause the symptoms. A famous naturopath and nutritionist in America has said candidiasis is the most underdiagnosed medical condition in the USA. Patrick Quillen. It's a true epidemic. So it has two functions. It gobbles up any putrefied food matter in our digestive system, because that's what it does. It usually feeds off dead material. And after we die, it will act to decompose our body, because now we don't have an immune system, so it can freely secrete its phospholipase enzymes and other enzymes and digest us, basically, so that we go back to the soil. Oops. Sorry, let's see what's happened here. No. Okay, I don't know why it's not working. Let's try starting from that slide alone. No, it goes back to the beginning. Okay, you can still see it, yeah? You can still see it, yeah? Okay. So, no, it goes back to the beginning. No, I think is a problem with the actual setup. Don't worry, Philip, because we're videoing. So, how do we get it? We've talked about the antibiotics, the steroids, other contraceptive, pills, excessive stress, elevated cortisol levels, tap water that contains chlorine, parasites, intestinal worms, diets that are high in sugar, refined products, constipation that is causing a lot of toxicity in the gut, drugs, alcohol, hypothyroidism, diabetes, that has constantly high sugar levels in the blood plasma, toxic metals, and so on and so forth. So there are many factors, but probably one of the most important factors is the antibiotics and the steroids. Because how many people have not taken antibiotics in their life? If you already have been eating wrongly and the level of your friendly bacteria already low, and you take one course of antibiotics, that may be enough to wipe out more of the friendly bacteria until they drop to that cutoff point where it triggers the gene to transform from the normal Candida to the pathogenic Candida. So it's not a microorganism that jumps in from the outside in, like a streptococcus infection of the throat because you've caught it from somebody else. You cannot catch systemic candidiasis. So if your partner has systemic candidiasis, you cannot catch systemic candidiasis. You may be able to catch a topical candida. So if they have it in their mouth and you kiss your partner, then it's possible to transmit that way or sexually, but not systemically. Systemically, the only thing that can cause the trigger to begin the pathogenic mycelial formations is when you do something to upset the homeostasis and the milieu of the gastrointestinal tract, i.e. decreasing those friendly bacteria. That is the trigger. And it can happen in men and women equally. It tends to be more common in women for hormonal reasons, but we'll come to that in a minute. Why is it a serious problem? Well, because it does compromise the immune system. It can lead to a lot of inflammation, and as you know, chronic inflammation can lead to chronic diseases, degenerative diseases. It's part of the pathogenesis of chronic diseases. It also produces 79 different toxic products, mycotoxins, of which some of them we know their biochemical mechanisms. For example, aldehyde, which is one of the mycotoxins, can compete with hormone receptor sites. So it causes endocrine imbalances. So it can suppress thyroid functioning, it can suppress adrenal functioning, it can suppress hormonal production from the pituitary, from the hypothalamus, and so on and so forth. It can upset the immune system. So when the yeast and the intestinal lactobacilli are in balance. We have a normal immune system where the suppressor cells and the helper cells are basically in balance. When we have more of these mycotoxins present in the system, then we have more antigens being produced by these white blood cells. And that sets up the body for an immune reaction with all the consequences. There is what's known as a Candida-related complex, whereby you have a complex, a syndrome of different symptoms packaged into one. And this is very difficult to diagnose, particularly by the classic medical fraternity, because this is not one of the nomenclatures that they have in their diagnostic nomenclatures. They don't have these groups like chronic fatigue syndrome, autoimmune polyendocrinopathy, immune dysregulation, candidiosis, hypersensitivity syndrome. It's a bit of a mouthful. The leaky gut syndrome, fibromyalgia, multiple chemical sensitivities, MS, other autoimmune diseases, hypothyroidism, endocrine disorders, emotionally related disorders. It can upset the neurotransmitter substances in the brain. You can get mood fluctuations. You can get anxiety, just like a generalized anxiety disorder. You can become depressed. There are many emotionally related disorders that can be related to Candida. In my clinical experience, I've seen many patients that were diagnosed by psychiatrists with generalized anxiety disorders, with depression, who threw away their drugs, and the symptoms completely abated when they treated the Candida. Vulvodynia, endometriosis, PMS, premenstrual syndrome, cystitis. I mean, a lot of women have cystitis because of Candida in the bladder, and they go to their medical doctors, their gynecologists, who give them more antibiotics because they may have picked up an Escherichia coli or some other bacteria in the bladder, which is just an opportunistic infection because of this complete change in the internal milieu of all these mycotoxins running around. Of course, other bugs, they like it. They like the environment. And of course, they get worse. And it's a vicious circle. I've had women with cystitis who have had in excess of 20 courses of antibiotics. And of course, they're rampant with Candida. We've already talked. These are actual. These are actual. I think deaths per year. So, you know, the deaths are increasing because of the immune compromisation. You can have Candida on the tongue. This was a patient of mine that had an underlying immune deficiency that was diagnosed clinically, and they were giving, of course, lots of antibiotics, but the man was rampant with Candida, and this was only 6 weeks into treatment. That was halfway into the Candida Protocol, but by the end of the Candida Protocol, he was cured. This is a case of psoriasis that I saw. This is before the Candida treatment. This is after the Candida treatment. So, you know, in psoriasis, in acne, in dermatitis, in eczema, in lots of these skin diseases, if they have systemic candidiasis, it's very difficult to eradicate if you don't eradicate the Candida, because it lives in there. It likes that environment. And so therefore, it's continuously producing these mycotoxins, and the skin is trying to get rid of them because the skin is a detoxification organ. This is rectal candida. This is vaginal candida. Very common in women. This is cervical candida of the cervix. This is of the penis. This is of the nail. I mean, if you see a patient that's had candida of the nail, you know, penetrating deeply, you know they've had it for years. It takes many years to penetrate into the nail. You cannot treat this nail fungus permanently until you treat the systemic candidiasis. And when we see nail fungus, we treat the systemic candidiasis with the protocol I will explain, but at the same time we put grapefruit seed extract liquid, 1 drop twice a day under the nails. It kills off the candida that is present in the nail, and then when the treatment for the systemic candidiasis is complete, the new nail now that grows out will not have any candida. And it does take about 6 months, you know, for the nail to grow, because nails are slow growing, and they will get nice shiny nails again. Nice shiny nails. This is candida in infants. This is a lady that I had with candida. I mean, this lady was suicidal. Yeah, because it was spreading, you know, all over. And when she came to see me, she said, you know, I'm on my last tether. I've seen so many doctors. And look, it's spreading, and you know, she was very upset and depressed, that cleared after the Candida Protocol. This is a case that I only saw one. It was a young 6-year-old child with Olmsted syndrome, diagnosed clinically in Israel with Candida. I mean, you can see the Candida. It's literally eating away the hand and the feet. It was the same. There we go. I mean, it just can destroy the tissues completely. Olmsted syndrome is an immune. It's a genetic immune compromised. I mean, the kid was born literally with no immune system. This is Candida on the arm that nearly cleared. It wasn't quite cleared because there was also a bacterial issue as well that we had to deal with, you know, a later stage. So what are the signs and symptoms? We can write 2 volumes of symptoms this thick. I never know now you know, what symptoms can be related to Candida or not. Obviously, there's the common symptoms, the gastrointestinal, the urinary tract, and the mental emotional. It can cause indigestion, it can cause bloating, it can cause distension of the gut, it can cause food intolerances, because now these mycelial forms are drilling into the mucosa of the gut and creating a leaky gut, which of course allows larger food molecules to now get into the system, which the immune system sees as an enemy, and so it will react to those. It can cause gastritis, colitis, flatulence, gas, chronic heartburns, fatigue, lethargy, weight gain. It can block the metabolism. We've already talked about the mental, emotional, and so on and so forth. Here's more: nasal itching, nasal congestion, blisters in the mouth, sore dry throats, abdominal pains, constant coughing I've seen with Candida many times, diarrhea, rectal burning, anal fissures, vaginal discharge, you know, increasingly worsening symptoms of PMS, premenstrual syndrome, prostatitis, and so on and so forth. Impotence, frequent urination, burning on urination, bladder infections, fatigue, drowsiness, uncoordination, lack of concentration, mood swings, wheezing, joint swelling, arthritis, failing vision, spots in front of the eyes, ear pain, deafness, burning, tearing, muscle aches, depression. It's never ending. The symptoms, you cannot know when you see a patient that these symptoms are related to Candida or not. My surprise in the nearly 20 years that I've been treating Candida now is I have seen miracles with patients that come in with a whole syndrome of different symptoms, and after a 3-month Candida protocol with a 2-month detox, they the symptoms just disappear. And they could have been chronic symptoms, you know, for more than 10 years, seen lots of doctors, etc., etc. So there's more. Increasing food sensitivities, chemical sensitivities, numbness and tingling, cold hands and feet, asthma, hay fever, multiple allergies, eczema, psoriasis, chronic fungal infections, athlete's foot, ringworm, toenail fungus, blah, blah, and so on and so forth. So these mycelial forms of Candida can dig deep into the intestinal walls, damaging the bowel walls, causing this leaky gut. It can attack the immune system, causing suppressor cell disease, in which the immune system produces antibodies to everything at the slightest provocation, resulting in extreme sensitivities. And you get people that just react to everything. Don't try and treat these symptomatically. You will fail. You have to treat it systemically. And often, when you treat the Candida, because the immune system automatically, as you offload the Candida, will improve, particularly if you're giving some background nutrients to help the immune system. As the immune system strengthens, all the doors of various allergens just close by themselves. Click, 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 they close, and you see the person who has been really hypersensitive suddenly enjoying life because they're no longer hypersensitive to everything. And in all honesty, I've seen a bunch of people with multiple chemical sensitivities who are literally intolerant and sensitive to everything. Smells, foods, nutrients, supplements, herbs, After a 3-month protocol with a couple of weeks of detox, they just disappear. They disappear. I remember a case of a Russian Orthodox priest who came over from Russia, who had developed a sensitivity to the incense that they use, the Orthodox priests use in the church. And of course this was a big problem for him because he could not conduct the liturgy in church because he was crying and, you know, getting headaches, and so we actually identified a mold allergy as well as the Candida, and there was mold in the church which he had remedied, so that that eliminated the mold in the church. And by the time that he had completed the detox, the Candida protocol, etc., because the Candida protocol contains remedies that can also eradicate a lot of the molds, like the aspergillus, like the mucido and rhesmosis, etc. And so 3.5 months later, he was back in church with a smile on his face. And I was blessed. This is Candida in the vaginal wall. It penetrates the tissues. This is why when you're treating women particularly, it's good to also use the vaginal suppositories of the albicansan that I will talk about in a minute, to eradicate all of this. Because you can treat the Candida systemically, yet it will still remain topically in one area. This is also a possibility. and then you have to then go and treat that topically. But it's best to do everything together, so in 3 months they're squeaky clean. This is Candida in the stomach. You see the mycelial forms penetrating the stomach? Look. And, you know, in a normal stomach, of course, this may be difficult if the pH of the stomach is around about 2.5, because the hydrochloric acid is so concentrated. It's about pH 2.5. You can actually pick up a drop and put it on a piece of wood. It will burn the wood. But of course, because the cells of the mucosa of the stomach has a lining to protect itself. But if you've got hypochlorhydria where the pH has dropped, and it's not 2.5, it's now 4, this mycelial form of Candida can quite happily live in the stomach as well. This is Candida penetrating the kidney and causing all sorts of nephroses and inflammations of the kidney. Are there gender differences? Women are more likely to get Candida overgrowth than men. It's 60% women and 20% men and 20% children. And the reason for that is because of the hormonal differences. Women have more progesterone, which increases the amount of glycogen that is stored in the liver. It's converted into sugar, and then the sugar is circulated in the blood plasma. Particularly during pregnancy, when the progesterone levels increase, this aggravates the Candida even further, because even though the patient may not be eating sugar, the progesterone is converting the glycogen into sugar. So this is also not good. How do you know you've got it? There are no conclusive tests for Candida. The laboratory tests measuring mostly the levels of antigens in the blood, but it's not a conclusive test. If you have like a leaky gut syndrome, you will get a lot of false positives from those tests. So the way that we can look at Candida and identify it, probably at this moment in time, the only sort of conclusive test that we have is the bioresonance diagnostics. Because if the client is resonating with an ampule of pathogenic Candida, it means they have pathogenic Candida in their body. You can also use Dr. Crook's Candida questionnaire, which is quite a comprehensive questionnaire invented by Dr. Crook with all his clinical experience. He was the one who wrote The Yeast Connection, the book. And you score it. So there's all these symptoms related to Candida, and the patient fills it in, and then it's scored. And if you're a woman and you get above 180, it's absolutely pretty certain that you have, because you've got all the symptoms of Candida, all the symptoms. And men, I think, is about 140. But that's a good check to do as well. You can also use autonomic response testing or kinesiology, muscle testing. So you can have an ampule of Candida and you see the weakness of the arm, because it will be blocking the autonomic nervous system. And then you've got, you know, all of these antibody antigen tests, laboratory tests. A lot of people do live blood analysis as well, using a dark field microscope, and they put the blood under the microscope and they say, aha, you've got Candida in less than 5 minutes of watching the blood. Candida lives in an acidic environment. The blood has a pH of 7.2 to 7.4. It's alkali. So the Candida cannot live in alkaline blood. So you cannot see Candida in a dark field microscope in 5 minutes. However, if you leave the blood for many hours so that it oxidizes and the pH becomes acidic, then you can see the mycelial growths of Candida. And I have seen that many times and videotaped it. But you have to leave the blood in excess of 6 hours, sometimes 12 hours. And then you actually see the Candida growing in the blood, because the fungal spores now, you know, have the environment, the acidic environment, to grow. Okay, let's look at the Candida treatment protocol. For anybody who's interested in seeing the full protocol in Technicolor, it's downloadable from any of my websites. I think I may have put it onto your link as well. It's now called the Vinci Candida Protocol because more than 5,000 patients have been treated at the Da Vinci Center. It's a protocol that I put together after many trials and experimenting, failing, and then asking myself why, etc., etc. It all started with my own health journey because I was also diagnosed with systemic candidiasis many years ago. I would read a lot of material on Candida. I would jump on planes. I would go and see the author. You know, they would treat me, and that would be a failure. So after doing that 2 or 3 times, I began to think, well, why are we failing? And one of the major reasons we were failing is because we were killing off the Candida for the 3 months or so of treatment, but we were not converting the pathological forms back to their normal forms. So if at the end of 3 months there was like 5% mycelial pathogenic Candida left, as soon as you change your diet and you start adding more refined food, sugars, etc., then you're feeding the pathogenic Candida. Within a couple of months the symptoms come back. And that's where I had to increase my own education to understand, well, you know, how can we convert this pathogenic Candida back to the normal Candida? And that's where I found the Sanum isopathic remedies that were invented by Professor Enderlein in his work. He's the father of dark field microscopy or live blood analysis. We'll talk about that in a minute. This was one of the first papers that I published in a biological medicine journal called Explore, I think it was. And that was back in 2005. But subsequently, I had a publication this year in the Sanum Journal of Biological Medicine. They actually published it in German and in English as well. That's available on the website, so you can download that. That has up-to-date information. So we have 5 objectives when we're treating Candida. The first thing we have to do is we have to starve the Candida by eliminating all the foods that feed it. And the foods that feed it are all the sugars. I will give you I will give you handouts of this. It's all the sugars in whatever shape or form. So it could be cakes or bickies, it could be honey, it could be maple syrup, it could be carob syrup, it could be hidden sugars in cereals, it could be fizzy drinks, you know, with sugar, etc., etc. It could be maltodextrin, that sugar. It's not only sucrose. It's also glucose and fructose and maltodextrin and all the rest of the sugars, with the exception of stevia. Stevia does not increase. Sugar does not increase. Stevia does not increase the glucose levels in the blood. It's metabolized in the liver, and it gets converted into stevioids, and there's not 1 ounce of glucose that gets shed into the blood plasma. So the other foods that one has to eliminate are the yeasts and everything that contains yeast, and anything that is fermented with yeast. So all the alcohol products, all the sugar products, the vinegar products, pickles, and anything that may contain vinegar, ketchups and mayonnaises and what have you. All the fruit must disappear for 6 weeks. Yes, because the fructose will be feeding the candida. So you cannot have any form of fruit unless it's avocado or coconut. These are the only two that are allowed. Everything else is out. And obviously dried fruits is out. But halfway through the protocol, once we've reduced the load of candida, because fruits also contain phytonutrients and carotenoids and polyphenols and all the other, good antioxidants, we don't want to starve the body of all those for a long period of time. So by adding 2 fruits a day thereafter, from the beginning of the 7th week, it's okay. But none will be juicy fruits. So we cannot have the citrus family, mangoes, pineapples, grapes, watermelons. This sort of juicy fruit is going to absorb the sugar directly through the stomach lining into the blood, and it's going to peak the sugar levels quickly. So we want to give the sugar levels very slowly in the form of a more solid fruit. Mushrooms of all types will aggravate the candida. Refined foods, so all the white flours, white rice, white pasta, heroin, cocaine, all the whites. That was a joke, by the way. Fermented products, so as we said, all the alcoholic beverages and the vinegar products, etc. Nuts are okay, but they have to be in their shells, because if they're exposed to the atmosphere, they will be attracting fungal spores that will aggravate the candida. When they're in their shells, they're protected, and you have to crack them and eat them, and that's okay. Yeah? So this has to be implemented religiously. There's no leeway for feeding the candida. Why? Because it grows exponentially. So 1 cell of candida in 24 hours will become 100 cells. In another 24 hours, it will become 100 times 100. In 3 days, it's 100 times 100 times 100, that's 1,000,000. And in 4 days, it's 100 million. And that's 1 cell. Most people have millions of cells of candida in their body. And so therefore, you cannot be feeding the candida. Everybody that has succeeded in the protocol has implemented this religiously. The few that have failed have eaten foods. I'm waiting for a young kid now, 26 years old, had other problems as well, including depression and what have you. And one depressed day, 2 months into the Candida Protocol, had 5 packets of digestive biscuits. 5 packets. Yeah. So I'm waiting, I think next week or the week after he's coming back for the testing. I'm biting my tongue. I think the chances of him succeeding is going to be a miracle, and it's very upsetting for me and for them to say, look, you know, the Candida hasn't gone, you have to continue the treatment, you have to do another month, you know, it's more cost in terms of supplements, etc., etc. It's really disheartening, and it's not good energy. So you have to really encourage your clients, and you have to, you know, call them back for reviews. You know, I call them back maybe every 3 weeks just to check that everything is going well. And we've tried to simplify things so that even uneducated patients can understand, but sometimes they don't, you know, and you have to keep on top of them, you know, to keep track. One lady that I was treating, who was uneducated, understood everything. She couldn't even sign her name, she was so uneducated. At the end, when we tested her, the Candida hadn't gone. And then we started backtracking. What have you done? What have you been? And she understood the concept of not eating fruit, but she didn't understand the concept of not drinking fruit juices. So she was drinking fruit juices, which is even worse. So these are the foods we've just mentioned. The second thing we have to do is we have to kill the Candida, eradicate it, through the use of natural anti-Candida protocols. And the protocols that I personally have been using for the last sort of 20 years is the ones that have worked for all these patients, and I dare not change them. Because if they work, you know, why reinvent the wheel? I mean, I imagine one can change some things and maybe do some more experimentation, but I don't see the need for it at this moment in time. It's a fairly simple protocol because we use this product that is made by an American company, Vitamin Research Products, called Candidaplex. It contains biotin, calcium undecylinate, some powder arco, and lyes, because Candida also form biofilms. These are coatings. They literally coat themselves in the same way as bacteria can be forming biofilms as well, to protect themselves against the immune system. One of the things that can dissolve those biofilms are these enzymes in this patented enzyme blend, cellulase, chitokinase, because a lot of it is chitin in the biofilm. Hemicellulase, protease, serrapeptase, amylase, lipase, etc. So the Candidaplex is a formulation containing a lot of good things that are doing a lot of things. On the website, when you download the papers, it will give you all these details of, you know, what it does, how it works, etc. Horopito is a herb that comes from New Zealand, and it's called Pseudowintera colorata. The Maui tribes used to use it for many different ailments, including treating fungi. When the Pseudowintera colorata, this is what it looks like. When they did the research, there was a professor at one of the New Zealand universities, and then this was validated by other research. They found that it worked even quicker than the antifungal drug amphotericin. It worked even quicker without side effects. So it's a very potent antifungal that has been well researched. There's lots of publications on the efficacy of the polygodiols, because it contains this phytonutrient that is more effective at killing candida than the powerful pharmaceutical antifungal drug amphotericin beta. So this is why I use it. The Horopito also comes in a cream, so you can buy Horopito cream intimate care for vaginal, you know, penis, anus, external, internal use. And you can also get the Horopito cream for fungus on the feet and the toes and in between the toes, etc. They can be combined in the treatment. The other thing that we give is the Acidophilus and bifidus. I found the best Acidophilus and bifidus to date that really does have physiological changes is one made by an American company, Custom Probiotics, and it contains 60 billion living bacteria per capsule. 60 billion. And they take 3 of those per day. The dosages are here. Candidaplex is 2 in the morning, 2 at lunch, and 2 at dinner with food. Horopito is 1 in the morning, 1 in the evening with food. The Acidophilus is 1 in the morning, 1 at lunch, 1 at dinner with food. We give a homeopathic Candida 30C. They just take 2 pilules, dissolve them under the tongue a little bit before food 3 times a day. And then lastly, we use the caprylic acid, about 700 milligrams per capsule, which comes from coconut, and it slows down the reproduction of the Candida, and they take 3 of those a day with meals. So you see, the actual anti-Candida killing program is not very complex, and that's what is required. But we also have to regulate the dysbiosis, converting the pathological mycelial forms of Candida back to the normal Candida, and that's where we use these remedies called Sanum remedies. They're actually developed by Professor Enderlein in all the years of research that he was looking under the microscope at these pleomorphic forms, and they're the only remedies that I know of that can actually convert the pathological mycelial form of Candida back to the normal Candida, because it's pleomorphic. If you like, it sort of switches off the gene switches it off. And this is critically important, because at the end of the 3 months, you don't want the patient to have even 1% pathological Candida. You don't. Because even if they have 1%, and believe it or not, the bioresonance diagnostics can pick that up, can pick it up. This is why I never test people in between the protocol until they've completed 3 calendar months, because they can be 3-4 days away from the 3 calendar months having 1% of the pathological Candida, and that 1%, if they start feeding it, will become 5%, 10%, 20%, and so on and so forth. So don't test clients, because you will find a certain percentage. Of course, it won't be the 90% maybe that they started with, but there will still be a certain percentage if you're 1 or 2 weeks away from the end of the protocol. Now, the Sanum remedies, because they clash with each other, and there's 6 different types, because they clash with each other, we separate them out. So the client is taking 1 in the morning, 1 at night, 1 in the morning, 1 at night, 1 in the morning, 1 at night. best way to take these is to have them in your bedroom. So as soon as you wake up in the morning, you take it, because these are away from food, and before bedtime you take it, because it's away from food. The albiconsan comes in a capsule and a suppository. So if you're treating a woman and she has vaginal candida, then you need to insert a suppository in between days. So the albiconsan is taken day by day, alternate days. You will also include the suppository in the middle here, and in the middle here, and in the middle here. So on those alternate days, they're taking the suppository intravaginally as well. The capsules are opened up and the powder is poured under the tongue and leave it to absorb sublingually. The tablets, again under the tongue, leave them to absorb 1 or 2 minutes. The taste is neutral. And you start the client on the specific day that they start the Sanum remedies, which is 2 weeks after the beginning of the Candida Protocol. So this starts 2 weeks after, on the beginning of the 3rd week, let's say. So if they start the 1st of the month, on the 15th of the month they will start this. And if that day lands on Wednesday, they start taking them on Wednesday. If it lands on Friday, they start taking this one on Friday. Whatever day happens to be the day of beginning the Sanum remedies, that's where they begin, and then they recycle, and they just keep on doing this till the end of the protocol, So in effect, they only need 1 packet of all of these 5 and 2 packets of the albiconsan capsules. That's it. So this is the custom probiotics formula, the 60 billion per capsule. They do guarantee 60 billion per capsule 1 year after manufacture. When they first start manufacture, they have tested, independent laboratories have tested in excess of 90 billion per capsule. It really, I mean, if you try this, you'll see physiological changes in your gut. It's an amazing product, really. So we have to optimize the diet, and pretty much you will optimize the diet, because by the time you remove the products that are not allowed on the anti-candida diet, by the time you've tested for food intolerances and removed those as well, they're pretty much on an optimal diet. I have seen so many people lose weight on the anti-candida diet because you've optimized their metabolism. Optimized, and they just shed the weight. Every week they will be shedding at least 1 kilo, 1.5 kilos all the way through. So it's an amazing weight loss program as well because of that. So we have to avoid the food intolerances. Now, what factors should be looked at as well as, because these are also playing a critical role in the whole homeostasis of the body, is the toxicity levels of the body. So before I start anybody on a Candida protocol, I take them through a 2-week detox, which is basically eating fruit and vegetables, steamed vegetables, stir-fry vegetables, vegetables in the oven, fresh salads. They can eat fresh fruits, but not fruit juices, because the fruit juice will give the sugar to the body too quickly. But they can have fruits, because we're not treating Candida now. We're cleaning the body. So during the 2-week detox, they can have fruits. plenty of water, and I will also add some parasite herbs to begin cleansing parasites from the body from the beginning of the detox to the end of the detox. If they have digestive issues like hypochlorhydria, not producing enough hydrochloric acid in the stomach, or they have a pancreatic enzyme deficiency, I will give them pancreatic enzymes, I will give them hydrochloric acid and pepsin. I will give them a good quality multivitamin to give them all the nutrients that their body requires for the healing process. I would give them krill oil to give them the benefits of the omega-3 fatty acids, which are anti-inflammatory. I will check to see that they're not constipated, because the worst case scenario for Candida is constipation. With all those toxins in the gut, you need to increase the peristaltic transit time of the gut by giving, again, herbs or other remedies for the constipation. I get them to check their morning temperatures underarm to see if their thyroid is functioning correctly, the Dr. Barnes temperature test. And if they're not, I will give them a little bit of Lugol's iodine, because most of your clients will be deficient in iodine because they're not getting sources of iodine, which is only present in seafood these days. Before, they used to fortify the animal food with iodine, but they stopped doing that now. You will not find it in the soils, it's depleted. So the only source of iodine is seafood. So if the patient is not eating seafood on a regular basis, they're going to be depleted in iodine, and in order for the thyroid gland to produce thyroxine, it needs iodine. It also needs the amino acid tyrosine. It also needs manganese and copper and zinc to transform the T4 to the T3, which is the active form of iodine, and so on and so forth. So, you know, checking the thyroid and helping to upregulate it is going to help systemically the whole metabolism, which means the efficiency of all the biochemical reactions in each and every cell will be upregulated. It's a big deal. I may run a tissue hair mineral analysis to see any mineral deficiencies, any heavy metals that may be present. I may give a heavy metal chelator like the HMD that we discussed yesterday. I would check to see whether they need some drainage remedies because of a compromised detoxification system. So you see, you don't just jump into a Candida protocol. You balance other issues that are also critically important in the patient. This is part of the holistic approach. The holistic approach. And you can do a lot of these things now using your bioresonance testing. You can check for a lot of these using bioresonance testing. Okay, we've already talked about all these foods. Summary, all the sugars, the yeasts, fresh dried fruits. Fresh fruits go back in the end of the sixth week. The mushrooms, the refined foods, the fermented foods, nuts unshelled are okay. This is all the remedies that we discussed. I mentioned the multivitamin, the omega-3s, as well as the other remedies that we've already looked at. These are the isopathic remedies. If the patient is allergic to penicillin, I repeat, if the patient is allergic to penicillin. They cannot take Fortikel, and they cannot take Nigasan, because they are penicillin derivatives. Even though they may be in a homeopathic potency, the patient will still react to them. And you'll see the patient will be on the phone 2-3 days later in a lethargic state. They have switched off. They've switched off. And if you do not get them off those, and there are cases where you ask the patient the direct question, are you allergic to penicillin? And they say, no, I'm not allergic to penicillin. But they are, but they don't know about it. If I get a phone call from a client and says, I have switched off, I'm feeling really tired, I cannot think, I've got brain fog, just feeling lethargic all the time, I immediately ask them to come back, and I test the Fortikel and the Notikel on the bioresonance diagnostics. I do VRT testing. And usually we find that that is the problem. Sometimes you may find that one of the other supplements may be blocking the autonomic nervous system. Could be Candida plaques, could be Horopito. So you have to be vigilant, one step ahead, so that if there are any reactions, and these are not the Hertzheimer reactions whereby you have, die-off and the mycotoxins causing symptoms which usually do not last more than 24 hours. These are more prolonged symptoms of a lethargy, an apathy, a shutting down of the system. The patient will not be able to function. They will not be able to function. Even they will take time off work because they cannot function. They cannot think, they cannot concentrate, they have no energy. So that's where you have to do your testing to determine what they are reacting to, and then make the appropriate adjustments. If you have to remove Horopito, let's say, or Candidaplex, you can substitute it with oregano oil. This is also a good eradicator of Candida, or grapefruit seed extract. That's also quite powerful. However, if they are intolerant to citrus, you can't give them grapefruit seed extract. The Hertzheimer reactions, which are because of the mycotoxins, now that we're killing off the Candida and they're secreting their mycotoxins, can be aching, bloating, dizziness, nausea, sort of flu-type symptoms, just feeling a bit lethargic, under the weather, maybe muscle aches, blocked nose. These are symptoms of the Hertzheimer reaction, but these are temporary. Acetaldehyde, which is one of the mycotoxins, can actually be neutralized by taking molybdenum. It's like an antidote, molybdenum. It's one of the trace elements. Why would treatments fail? If you're not using the correct antifungal therapies. If you are not using the Sanum remedies. I have never seen any case of Candida being completely cured without the Sanum remedies. They feel better during the antifungal therapy because you're killing off the Candida. Hopefully you've put them on a correct diet, you've given their body the nutrients, you've detoxed them, etc. But the symptoms will come back again 2 months later, 3 months later. because you haven't eradicated all the pathogenic candida. If their digestive system is not working it's not up to par, because it's not producing enough hydrochloric acid, they're not digesting protein, there's putrefaction of foods in the gut, the pancreatic enzymes are not sufficient enough to digest and so on and so forth. That needs to be fixed. The thyroid, the constipation, the parasites, the discipline of the patient with their eating habits. These are all critical factors that you need to address from the very beginning. And it's very easy. I address these on the first session. There is hope. We have seen a lot of smiling faces from people that have been chronically ill with a whole syndrome of different problems, going through the Candida Protocol, this one, and really getting very much better. Very much better. And I think if you live in a culture where there is an abuse of antibiotics, and it could also be antibiotics given to humans as well as antibiotics given to animals, and then the humans eating the animals. Unfortunately, here in Cyprus, we are off the scale regarding the use of antibiotics in animal feed. We're off the scale. So if you live in this type of culture, expect at least 30% of your clients to have Candida, if not more. If not more. A lot of practitioners now, like in America, are talking 50s and 60%. That's what they're talking. Yeah. I see it in young kids now. I've had 3.5-year-old kids who have had 7 courses of antibiotics. 3.5 years old. They start young. My children have never had antibiotics in their life.